Here.
Katie Landry.
Here.
Butch Newton is on.
Here.
Oh, perfect time.
Traffic is.
Oh,
Me, Bernal Lemoyne.
It's coming.
He's coming that late. Vicky
Here.
Phyllis. Here. Deborah Thrower is not here. She may well be because she's really Laura Smith, and she said she was coming, so. Donna, Mia LeMaire, Angela Lee, Matt.
Here.
Kevin,
Here.
Michelle Broussard, Shannon.
Here.
Chris Miller is not coming. He's has a testing issue at his school.
Burnell's walking in.
Thank you. Hello, Mr. Lemoyne, how are you? Next item on the agenda is approval of the agenda.
Ms. Nancy,
Yes.
can I pause for a second? Can I just ask about your two members, Michelle Broussard and Angela Lee?
Yes,
They haven't been here for quite some time,
right,
about 9 meetings to be exact.
right.
So with that representation, can we either look at replacing them?
We plan
Yeah.
to do that at the next meeting. I spoke with Angela.
Okay,
She still wants to be on the committee, but it depended on whether she showed up tonight.
okay,
She's not here. She may want to do it, but we'll just have to find somebody to replace her. And Michelle represents,
LPAE.
that's what I thought,
Yes,
she's
ma'am.
an LPA rep.
She's never showed up to any of your meetings for 9 meetings back to October
I
of
thought she was
2020.
sped, because I'm LPAE.
So,
That's me.
I thought Chris Mailer was the other
Chris Miller is
LPAE.
LPAE.
Yeah.
Yeah. And
Okay.
he
You're
planned-
clerical, Ms. Dawn, if
Okay,
I'm
yeah.
saying that correct.
He planned to come, but he has something happened with the test at his school,
Okay.
so he can't come.
Times I agree with you.
But I agree, but
I
we're gonna
agree.
address it as the.
Those groups need to be represented.
Yes,
There's
ma'am,
some
yeah.
meeting.
I know it was a big point in your bylaws with
Yeah.
regard to having members represent the groups that they have, and those
Right.
two have not been here consecutively for a
And
very
there
long
is, I don't
time.
have the bylaws in front of me, but our recollection is
I've got them.
there's a provision for too many absences. We left it pretty generic, as I recall.
Yes, ma'am.
And it's,
It says repeated absences from committee meetings may result in the removal of a committee member. You don't have any specifics, but yes, ma'am, I think that if we could have representation and
so we
change
will
it.
put it on our summer agenda, if we don't have a meeting before then. And the committee will have to vote to declare those positions vacant. Then we'll have to notify the board and go through that same process.
Okay, I just wanted to bring it to your attention. Thank you.
Approval of the agenda. I need a motion to amend the agenda, specifically 2.3, vacancy announcement for school food service position, because as I was leaving the house to come here, I got an email from Renee Sherville with the name of the person who will represent school food service, Tonya Christopherson, whom Vicki knows. So is there any objection to amending 2.3 from vacancy announcement for school food service to appointment of school food service? Do I have a motion to amend the agenda?
I move. I second.
Nancy, I would like to also add something to the agenda.
Okay. Katie?
And I know it takes a vote of the committee. I would like to add the need for transparency as stated in our bylaws and school board policy, BBC.
Need for transparency. Is there a motion to amend the agenda to include that? You want a discussion item or not? You don't want to vote? Or is it a vote?
Discussion
A
later.
discussion item. On transparency. Burnell moves. Is there a second?
I second.
Okay. All those in favor?
Aye.
Anybody opposed?
Opposed?
Okay, then, and I know it just takes one to oppose, which is amazing. We're going to oppose bylaws and policies, but I do request that it be put on the next agenda.
And so it's a discussion on transparency.
The need for transparency as described in policy and bylaws. discuss policy amendments and transparency.
It will be done. So we will have that on the agenda, and we will have the membership issue on the agenda as well. So that's, all right, next item, approval of the agenda as amended. Have a motion to approve the agenda as amended.
Motion to.
Deborah,
I motion to approve the agenda as amended.
is there a second?
I'll second
All those in favor?
it. Aye.
Opposed? Next, approval of minutes. Need a motion to approve the minutes? Is there,
So I'll
Carol, is there a second?
I'll second.
Mary Jane? Okay. Next item, 2.3 is the one we amended to select a representative for school food service position. The person submitted by the department is Tonya Christopherson. Do I have a motion to appoint Tonya as the school food service representative?
Is she here at central office or is she in the field? Do we
She's
know?
at
She's a
school food
secretary.
service. She's Renee's
Here.
secretary, school food service. We're at Four Corners.
Yeah, yeah, the old, cash
Evans
building
Electric
or
Building.
whatever, yeah, I remember that.
She's Miss Sherville's secretary, and she is point of contact at the building.
Okay.
So move.
Butch?
Second.
Is there a second? Vicki? All those in favor of adding Tonya as the school food service representative? Aye.
Aye.
Opposed? Okay, I will contact her. Next item is silver scripts. Mr. Fontaine?
First,
Smith.
silver scripts.
The
We've got a
reason
spot
it's-
right there, I can move.
The reason it's on the agenda is because we've had complaints from retirees that some costs have gone up. I know some costs have also gone down, but there have been complaints. I know I've had increases in inhalers, all of them have gone up in price. It's not a significant jump, but they have gone up. I've also had some that went down, but since, I don't know if this is a change in formulary, if it was a change in January, I don't know what happened, but I just think we need to address some of the concerns about increased costs.
There's been no changes in the silver script formulary whatsoever.
Yeah, I mean, every January, just like on the commercial side, the plan you guys were on prior to moving to silver scripts, actually multiple times a year, the formulary is updated, and pricing of medications can change from month to month when you go to the pharmacy, depending on the cost for each pharmacy. So those prices fluctuate on the commercial side as well as the egg whip. That's really, really no different. But what you're mentioning with regard to cost in January, come January 1st, that's when CVS does make edit to their pricing, their discounts. So you might see a decrease in the cost of some meds, you might see an increase in the cost of some, but that'll happen every January, and it usually happens mid-year around July on the egg whip plan in particular. But there was no changes from a member cost copay perspective or anything like that, but when the prices fluctuate from the manufacturer, it filters down to the members. So we
And the
had
only
that.
time you'll recognize any of that is if your cost of your medication is less than your copay.
But then what's happening though, like your copay may have been like $7, and but a lot of, I think the complaints would be it goes from $7 to $12. So that's where, we're still within the $30 range as far as for copay, we understand that, but that's what I think the complaints would be from, we're going from like $7 copay, and next time you go at maybe $12 copay.
And that's something that's gonna happen.
Oh, yeah,
rest of the
yeah,
life.
yes, yeah, no,
That's
Shannon?
something the industry.
Shannon?
I know an issue that was brought up at a previous meeting was the increase in price related to people who were on medications that were part of a copay assistance plan. And copay assistance plans, people who utilize copay assistance plans, those plans only apply to folks who use private insurance, not people who receive Medicare or federal related
Correct.
insurance.
CMS doesn't allow.
And so a concern that I have in order to be able to accurately represent the people who it's my responsibility to represent is that when the EGWIP program and Silver Scripts was presented to us, it was presented to us in a way where we were told there would be no changes. People would experience no changes. And that's a very big change, and I just wish that we had that information. Because it wasn't clear to us, we're educators and education adjacent people. We are not insurance professionals, we're not medical professionals. We don't know, I know we don't know that an EGWIP program or the Silver Scripts program changes that insurance source, that it's more like a federal, that's no longer private. So we wouldn't really, I don't feel like we would have had a way to know that that was the position that we put the people we serve in. So my request of y'all the next time a change like this comes is I would really like to see more of a breakdown in how that process works. Like whether, let's say we change insurance, it seems to affect retirees more so with the federal programming. That we get a more detailed breakdown of, okay, this is what an EGWIP program is, this is what it does, this is what type of insurance it is. I think that would really help us make a well-informed decision. Because I know I personally have, it's been weighing on my conscience a little bit as someone who, like, I benefit from a copay assistance program. And it's sitting on a it sits on my conscience a little bit that I put people in that. I'm partially responsible for putting people in a position where they may really have to struggle to get their medication that they need, or they may not have access to it. So that information is something I would really appreciate from y'all moving forward.
Brooke, correct me if I'm wrong. We couldn't have determined that anyway because it was done at the point of sale. Kind of like when you go to a grocery store and the item is $4, but if you have a coupon for it, it reduces it at the point of sale.
But a copay assistance program is different because when you enroll in a copay assistance program, when you go to enroll, it says, it asks you when you fill out the application at least 3 times, is this through private insurance or are you receiving Medicare or other federal things? It's not quite the same as a coupon.
Some of the members were utilizing it that way, either through a manufacturer coupon given at the point of sale, or I understand what you're saying, and I'm aware of it.
It's twofold. So you have 2 things going on here. You have the manufacturer assistance program, which will take away some of the member out of pocket for the drug, and also can provide plan savings. And then you have the coupons at the point of sale that we don't know or would never know that someone was utilizing that coupon because it happens behind the scenes. There was no, I guess hindsight's 20/20, but there was no way for us to know who was using a coupon and who would have been impacted by that. The EGWIP Part D plan follows the same rules that any Part D plan governed by CMS does, and you can't use a coupon. So,
But we didn't know
that's
that.
why.
We did
Right,
not
and I
know
think
that.
that's Shannon's point.
Right.
And that goes back to
I have
what
a
Katie
question
wanted
there.
to talk about, is the whole issue of transparency.
That's why we should never say no change.
No change.
No change.
Because that was said at one point.
That's why we,
That's
that's why we're here.
Because it's
That's
gonna
why we're
happen.
here.
Somebody's gonna it's not gonna not change for somebody. So it's best not to ever say that. It might be minimal change, but.
And if you were here, Brunel, we asked those questions. It's not new.
Anybody else question?
Interrupted.
No, interrupt all you want.
There's a great, Consumer Reports, this, for the May issue, has a great report on drugs. I mean, the front page shows a particular drug at the different pharmacies and whatnot. And one will be $13, one will be $7, one will be $0. And if you can get a copy of it, it may help you kind of understand what you can get. And also, there's also the other programs that are coming online where you can benefit from that. The Good RX, and then there's a few. They're coming online like crazy. There were two others that I knew about. And just recently, there's another 2 or 3 that have come out. And sometimes, and I'm participating in that. If you're on generic drugs and it's an old line drug, they're cheap. And instead of getting a 90-day script, I get a 180-day script. Okay, so, and in several of the cases, my additional script was like $5 more. Okay, so I paid $20 for the 90 days, but for 180 days, it's like $25.
But you're not using SilverScript, right? You're using
No,
GoodRx.
we're bypassing completely, the
But that doesn't
LPSS.
help in every situation.
Do what?
It doesn't help in every situation.
No, I didn't say that, no. And if you're looking at, like, say,
And
the
EpiPen.
the EpiPen, no, it's not gonna help you there, or the newer medicines, it's not gonna help you. I mean, we have one lady who was on this particular program that she's talking about. Her monthly payment was like, I think, $5 or so, but then it went up to like $3,000. That's how much that particular, but it's a new drug. I think it's New Cala, and it's for asthma and whatnot. So there's a change. I mean, and this lady was pretty much upset. But once again, this is all part of if she's on Medicare, that's it,
But I'll give you an example. I mean, I'm under the active high deductible plan, and I have instances where I have to use GoodRx too, because if it runs through Blue Cross insurance, a certain prescription may cost me more.
Sure.
So I utilize features like that too as my plan. Sometimes it takes some resourcefulness.
Sometimes it doesn't help. My mother's on Namzera. That's from memory. Her month was $150.
Sure.
I mean, you go from $30 to $150. Then you go, where's the reasoning in that?
I would say in those instances, if they are reaching out to SilverScripts to try and get some answers, if they're still not receiving those answers, if us at insurance don't know about it, we don't know how to make additional phone calls, do resolution. I'll give an example, like when we were discussing SilverScripts and these cost increases, I did reach out to Butch ahead of time and I said, hey, please let me know if you've got any members that are experiencing some issues. He circled back to his people that he typically emails to, and I followed up with him again, and no responses. So I would say for those one-off situations, instances like that, if we don't know about it and I can't try and assist the problem, even if they've tried to contact SilverScripts, please have them reach out to insurance, because I'm not hearing any type of negative feedback with regard to instances like that, because members are not calling us. When Butch reached out to his people, we didn't get anybody returning that
I
message,
haven't heard
right?
anything lately. Now, this particular lady, what she had to do instead of getting this particular drug, had to go back to some of the older drugs. Okay, I mean, and that is an alternative. There are other drugs.
That is true. I went to an older drug, but now the insurance won't pick it up and I can't get it. I'm just saying. So there are some problems.
Carol, your mother is on the plan, isn't she? Is she on SilverScript?
Yeah.
Yeah, through school. I mean,
yes.
she
Oh,
LPSS.
yes.
She worked for LPSS.
Yes.
That's what I thought. She was
Yes.
a member. Okay.
Please email
It's
me.
not-
I'll
it's
see
not-
if I can help.
And you have a few people, but if I had to reach out to the people that it would be, I don't want to reach out because.
Well, I wouldn't want a member have to not take a drug that they need. I wouldn't want a member to pay an additional amount that they shouldn't be paying. So in instances like that, definitely reach out to us. I don't know what assistance I can be, but I loop Brooke in those conversations, and we work through it with SilverScripts to try and get you a solution.
Well, the commitment was made, because I wrote it down 3 times as Lynn was saying it, that nobody would be without the medicine they needed.
That's
That
not true.
commitment was made.
That's not true.
But that's what we were told, so if it's not happening, we need to know about it.
Yeah, we definitely need to know
You need to
because
know about it. That's how the plan works.
we've had members that actually needed to take a medication that was not on the formulary at all. We worked and helped that member get a formulary exclusion granted. So So there are situations where even though that drugs may not even be on the formulary, they understand that you can't take this or you can't take that. And it goes through a prior authorization process, and we've had members approved that way, so please let us
But
know.
what do you do when you have a manufacturer who's inclusive? An EpiPen, I can't get a generic. I mean, that's the only thing I can get. So how do you negotiate that? And that's just one drug. So how do you negotiate when there's no generic and no alternative?
But
what do
she's
you
not,
do?
she's, with the prior authorization, it's physician's input. So
Right.
if, your physician's gonna know you the best, and they're gonna provide, like, we're not physicians, we can't make those calls, but they're gonna reach out to that member's physician and get additional input for that prior authorization to see if we can possibly help the member.
But we
May
have
not
prior
be
authorizations get denied too.
correct, exactly, that's what I was just about to
Been
say.
there, done that.
Very
And
rare.
we,
I won't have
yeah,
to
I
talk
can
about
tell you on the Silver Script plan, the prior authorization approval was super duper high. Most people got that approval. If for any reason, I'm not gonna say every PA was approved, because they're not, and they're not all
No, it's
getting
not.
approved on the commercial side either. Because if the doctor may not provide what's necessary for the approval, and it's reviewed and it's deemed you could try something else, they're gonna want you to try something else. But what I want you guys to know is, if anybody is not getting what they need, and y'all need help, that's what we're here for. So please, reach out to her, she'll reach out to us, and we'll help.
Shannon?
And for,
Oh, sorry.
go ahead.
Okay. Just thinking ahead for like the next time we have to make a decision like this, would you be able to provide us some data on how many members we have who are taking medications that qualify for copay assistance programs, so we could get an idea of how many people this would affect? Because I know that you have, in the report that we get every 3 months, it has the top prescribed and the top used medications. So would there be a way for y'all to provide us numbers of people who are on medications that are, I don't know if you would be able to find out if they are actually utilizing a copay assistance program, probably not, but if you would be able to find out how many members we have who are on medications that have copay assistance programs. That may give us a better, that information coupled with what type of plan it is, whether it's federal insurance or private insurance, may help us just make a better decision. If you would be able to compile that for us.
Yes, the second part, I can probably get that.
Okay, great, thanks.
Anything else about Silver Scripts?
Can you go over the cost savings and everything, Brooke?
Sure. So, basically, as we mentioned before, with the Silver Script program, the savings will build over time, right? And that's because the utilization occurs, then the rebates come, and all the reimbursements will filter in. And as these quarters mature, those reimbursements mature. So now that 2021's over, we had a full year of the EGWIP plan. And if we look at the reimbursement savings for the 2021 plan year, and what we're looking at is the difference in subsidies of what we were receiving before, what we're getting with the new year, plus the additional reimbursements that we're able to get through the federal government, like those, it's called a gap reimbursement. Those are reimbursements we were not receiving prior. If we look at total 2021 plan year, we're at about $2.3 million in reimbursement savings alone on the EGWIP. Of the $2.3 million, we realized to date $1.8 million, and we have $630,000 pending, which will be received at the end of December of 2022. So about $2.3 million, we received $1.8 so far, and projected to get another $630,000.
So just as a note, that 630 that she's speaking of, that is in your fiscal year 22-23 projections too. So it won't be in addition to those monies that you saw in the budget.
Correct. We filled 77,100 prescriptions through Silver Scripts. So members are getting their medication. For those that are experiencing any issues, like I said, please let us know. We're happy to help. So about 6,500 scripts a month. Now, if we look at 2022 as compared to 2021, like I mentioned, these savings are going to build over time and get larger. In 2022, we have increased subsidies as compared to 2021, increased gap reimbursements. So we're looking at a 2022 savings of about 2.6 million as compared to 2021. And for the first quarter, we filled almost 20,000 scripts just for January to March. So 2.3 million last year, another 2.5 projected for this year. Next year, that 2.5 is probably going to grow into a larger number so that
But does that include, because we have to meet the deductible, then the cost of medication may have gone up. So I can see you getting more money, but at the cost of me.
the claim utilization that we're going to go through in a little bit, when he goes through the claims, you'll see the cost portion, the plan cost portion. This is strictly additional checks that are sent to Trish for subsidies every month, additional money that we didn't have before. Not even looking at claims. We'll go over claims in just a little.
But still, what I'm trying to say, you are getting more reimbursement, but it's costing me more. That's the bottom line. That's how I'm seeing it. Unless I'm just in the fairy tale world, you're going to have a larger reimbursement, but I'm going to pay more out of pocket. And at the beginning of the year, we all pay more out of pocket because we have to meet that deductible. And then if you meet the deductible and the cost of medication goes up, your January, February, March is going to look real good.
Right.
So
We'll
with
go over
those
that.
kind of reimbursements, we should be in good shape
We should.
right now.
But please let me know. I mean, I'm happy to look at utilization and do a comparison.
Anything else on silver scripts before we move on? Next item on the agenda is AFLET. The reason that's on our agenda is on the, and I don't know how many people have had calls. I know Butch has had calls. I don't know if anybody else has had calls. But on the retired teachers Facebook page, it was pointed out to me there were close to 70 complaints just on that one page. And I mean, I have a list of what many of them are. They range from they can't get in touch with anybody in the insurance office. They didn't receive an AFLET card, so they couldn't make a claim. They never signed up for AFLET, but it got deducted from their paycheck, and they can't get that straightened out. That it was a mess. That was down there several times. Somebody got 3 cards. Someone else said it was the biggest mess ever. They sent in for reimbursement in February. They still have not gotten a reimbursement. Someone else who was automatically put on AFLET who did not ask to be put on AFLET. They were told that the situation with AFLET was equal to or better than DINA, but this person said that what benefits she had with DINA, 2 cleanings a year plus an x-ray were completely covered. Now with AFLET, even 1 cleaning isn't completely covered. LPSS will not return my calls. DINA was taking out $19.95 out of her check. AFLET is taking out $33. And it goes on and on. So there are over 70 complaints. I don't know what the problem is, what the basic problem is, but those are the ones that I've read.
I've also heard that a lot of the dentists that they were using with DINA are not covered. So they're having to file their own claims and get reimbursed. And we were told that almost all of the dentists would be covered.
We were told all that's
one of the complaints I've heard is that their regular dentists no longer will not accept AFLAC but accept the DINA.
So keep in mind when we were having those discussions, we mentioned that there were a ton of people who were using out-of-network dentists. So likely with that example, they were likely seeing an out-of-network dentist. So keep that in mind. Now keep in mind the out-of-network dentist still paid the 90th percentile. We still have lots of members who are using their out-of-network dentists where things are still processing through. Each individual dentist is an individual dentistry. Keep that in mind too. It's not like a physician's office where you have multiple physicians in that office. It's typically one dentist, and they manage their office as they see fit. We've had out-of-network dentists still billing on behalf of members. Some are not. And it's more or less a customer service offering that I believe based on that particular dental office.
Add dentist and attempt to add.
We can. We compiled a spreadsheet at the beginning where there were a couple dentists that were out of network, and we did make a list that we sent to AFLAC to where we could request that an AFLAC representative reach out to them and see if they wanted to add on. But keep in mind, dentists are individualized. So oftentimes they don't accept any type of insurance, and everything, they don't even bill for any provider. And it's really just based on that particular office.
But these people are, for the most part, all of these people were going to a dentist who was fine with default, but is not with AFLAC. And the thing that was, a couple of things were most disturbing to me, but one of them was the number of several people who had AFLAC deducted from their paycheck and they never signed up for AFLAC. How in the world is that?
Okay, so I wrote that down when you mentioned that too. So keep in mind, anybody that was under, I'll use retirees as an example and then actives. Active members, if you had Dina Dental, you were automatically rolled over to AFLAC unless you made changes during open enrollment. Okay, if you did, we made numerous communications with active members prior and during open enrollment that said, hey, we're changing providers. If you need to make changes, this is your opportunity. If you don't do so, then yes, you're gonna roll over. So in that example for retirees, anybody that was deducting under a teacher's retirement pension, they would have rolled directly over to AFLAC too. For members who were billing, Dina Dental accepted a credit card where AFLAC does not. It has to be a bank draft. So for those members who were drafting under bank draft, we had to have them fill out the form, they returned it, and we were drafting from their bank account. But everybody who was under teacher's retirement, unless they canceled the coverage, yes, they rolled over. They were made, we sent out communications that provided information that if you needed to make changes, either contact our office or contact AFLAC directly. There was a point of contact.
What do these people do who say they contacted LPSS, told them that they did not ask for the AFLAC dental, it's being deducted from their paycheck, and they can't get anybody to answer?
All of that sounds incorrect too. I'll be honest, my staff is absolutely wonderful. They return those phone calls within 24 hours. If you've got a point of contact for a member who's having issues with regard to your examples, please have them reach out to me because...
All you have to do is go to the Retired Teachers Facebook and you can read every one of them.
So I'll make that public comment here this evening. If anybody is experiencing issues, as you just named, contact LPSS Insurance so I can resolve the issue. I will help facilitate it. I will make sure if the member does not want AFLAC, we can have it canceled. But I feel that I was a primary point of contact for AFLAC during the change because I knew the most about the changeover. I've talked to a ton of retirees to include the statement that you made about people being charged and not being reimbursed. There were 6 members. So if there are any others outside of those 6 and we have scrutinized the billing left and right, then I would say, ma'am?
Go to the Retired Teachers website because the name, I'm not going to give out the names of these individuals tonight, but you can see the names of the people who are making the complaint. So it's very clear. You'll know whether they contacted your office or didn't contact your office.
So here would be my thought. My thought is if they're posting in on a Facebook page or perhaps notifying you, why are they not calling LPSS Insurance? We are the go-to to where I can help resolve that issue. In all honesty, you cannot.
No.
Just like a Facebook page cannot.
And a lot of them get on Facebook as a platform to write and complain.
But when
Not
people
per
call
se
me,
those people, but the universe in general,
Yeah.
right?
But to choose to complain about a dental program, there's a reason they're complaining.
but I have to say, people that have called me, I don't have AFLAC. I always say, call Trish. Trish, I
Right.
always say call Trish, because Trish will answer and return
Call
all
Trish.
calls.
Email Trish,
I do
call
say
Trish,
that.
I promise you. I will follow up with you.
I do.
I've had
Yeah.
With these 6 reimbursements in particular,
They will.
it was a bit of a struggle. We did have some challenges with regard to it, and I kept in contact with those members to ensure that they were communicated to so that they would know what was going on. I even have one member that contacted me today that we're still having a little bit of a discrepancy on, and I'm working through the issue. But I would, like, if I'm losing money, I'm gonna go to the source and try and figure out what my problem is to try and get it
And they
resolved.
say they have.
So that's odd.
The 3 that are listed, that are on here, say they have. That's why my suggestion to you, because I don't think it's appropriate for me to give out their names, is to you to go to the website and you can see the person.
Okay, I will, if I have access, I will try and utilize
It's
it.
at public access.
Public access. Trish, let me If ask you're you on this. Facebook, I'm not on Facebook.
No, I'm not on Facebook and you can still.
Let me ask you, for those who are having it withheld from their retirement checks, and you said they were doing that before it just rolled over, and I understand that.
Yes.
But some of them indicated that they wish to switch to bank draft. Do they have to wait for open enrollment to switch that?
No, ma'am, we can make the change.
At
I
any
can
time.
take them off of
Okay.
teacher's retirement. I can
Good.
give them an
That's what I
ACH form
needed.
and we can
Okay.
move it.
Good.
It's not, in all honesty, it may benefit them. If that's what they choose, I can make it happen. We have
Okay.
those forms.
Thanks.
The
I didn't know
bank
they
draft,
had
and
to
I would
wait.
encourage that, the bank draft is so much more simple, because when you deal with retirement, we have a timing problem, and you get crisscrossing, and then you get differences pop up. I would suggest that everybody go to a bank draft, you know, and it is convenient to have it pull out your check, but you have those issues.
Okay. I just didn't know if we had to wait for for them to
Oh,
wait
no,
for
please,
open enrollment.
No.
It's good to know that we don't.
Technically, retirees don't have an open enrollment.
Okay.
I can help facilitate that. I just wanted to emphasize a few more things. So the positives of the change, grandfather retirees received an 8% reduction in the premium for Aflac. They received a premium forgiveness due to the issues that we have with teachers' retirement and teachers' retirement not setting it up on time. So they received 1 month reprieve with regard to premium forgiveness. The network did increase that if those dentists that they were seeing were indeed in network. Dina Dental used Dentamax, Aflac uses Dentamax. So it was a wash, essentially. Aflac added 200 plus dentists for our area, in our area that we're in right here, that members could see, to include Wisdom. Wisdom was a big consideration with that conversation because members had to drive to Baton Rouge to find an in-network dentist with regard to wisdom teeth. That's a huge inconvenience. We now have dentists who can remove the wisdom teeth who are now locally in area. The other thing I wanted to mention, Dina had a 10% increase, Aflac had a 4%. And members still are able to use their both in and out of network dentists. They're still payable at the 90th percentile. Those dentists will still honor the 90th percentile. So just want to emphasize some positives and then reiterate, if a member's having a problem, please have them call me. My number's 521-7064, okay? I promise you, I will resolve it. I will keep it in my pending folder until we help the member.
And I
Thank
can
you
tell
for
you
sending me
from,
the list of dentists. I couldn't get it. Thank
Yes.
you for sending it to me.
Okay, good.
I can tell you from dealing with Trish, and we've been working on some stuff, so I've been trying to get in there, and I'd gone in there and she was on a phone call with a member, and I said, I'll come back. I came back 45 minutes later and she was still on the phone call with that same member. And I asked her, is that the same person that was there when I was here 45 minutes ago? And she said, yes. So when I see it every day, this woman is on the phone working those problems, and she is tenacious at it.
Oh, listen, I have to commend
Complimentary
Trish.
Trish on your.
I've never had a problem. I call Trish, I email Trish late at night. When I wake up the next morning, I have an answer. So when it comes to telephoning, when people call me and I don't know the answer, and they'll call me back and say, I got Trish. So
I will say this. So Pam Belmore, who is the primary contact for retirees, okay, keep in mind, she's working with active members too.
Yeah.
This is a very busy season for her. You've got active members who are moving to retirees. I'll be honest, retirees do not like to leave voicemail. A lot of them do not, okay? But if you leave a voicemail, I promise you, Pam is on the spot Johnny with that. She will call you back. She checks that voicemail constantly. But the problem is that what tends to happen is the member calls and calls and calls, and they don't like to leave that voicemail. And I'll be honest, if you saw how many calls we get within a given day, I am not checking my phone calls to see who called me. But those members who leave me a voicemail or an email, I'm responding back to those members. Otherwise, I'd be spinning wheels all day long saying, hey, I'm sorry, did you call me? What can I help you with?
Tricia,
So-
I have to say, I dealt with Pam last week. I needed a form to change beneficiaries. Didn't realize it was on the website. Got the voicemail, emailed her, as the directions said, and then emailed her back and said, never mind, I found the form, thank you. But she had already done the form
Yes.
right away. And I have to say, she responded within 10 minutes.
Yes, Pam is very good. She is, that email's coming through constantly. In all honesty, she's on the email like that, and then she checks.
She's faster on email than phones.
Well, what ends up happening is she has, keep in mind, scheduled appointments for active members.
Right.
So if she's blocking a time to have a conversation with a member who's retiring, who's active, she's not going to answer that phone when you
Right.
dial through.
Right.
If you don't leave her a voicemail, then of course you're not going to get a response back. So that's why it's super important that if you call insurance, you can't just repeatedly call. You do need to leave a voicemail or perhaps email. And I promise you, she is fantastic about returning phone calls and emails. It's just that you got to go through that next step and tell her your name and your information so she can return it.
Could you possibly post or ask Patty Crater to post on that retired teacher's Facebook page? That anyone with a problem with Dina, put Tricia's name, Tricia's phone number,
Dina
and
or
Belmore's name.
Okay, and Pam's, okay.
phone
Yeah,
number.
we can do that.
And tell them to make sure they have to leave a voice message.
Good idea.
And we tried to emphasize that with the last
Put their
communication
emails
for the
as well.
newsletter.
In
Yeah.
case
They said
they can,
change.
Or email capable.
Yeah,
all of the
yeah. We can do that.
Okay, anything else about Dina Dental? Nobody?
It's Dina Denton.
I mean,
Affleck.
Affleck, I'm sorry.
Okay.
Former dean.
Formerly Dina Dental, when we didn't have any complaints. Retiree communication system, Trish?
So I emailed that attachment. You asked me to go back to the drawing board and do a couple more solicitations for essentially a call, a text, and a text message or call, and an email. I'm sorry, I was trying to remember the three. So I came up with a list, tried to offer as much information in the small space that I had so you could review it ahead of time. For the most part, there are 1, 2, 3, 4. There's 4 that offer those options to you. And they, for the most part, kind of offer the same type of services. Your Blackboard Connect offers unlimited messages for every single month. Your Dial My Calls offers 30 broadcasts. So broadcasts would be each one of those items, a text, a phone call, and a email. So keep that in mind. They're very similar in nature. They all pull reports. A majority of them work with training with regard to us for staff so that we can send out those communications to you. Pricing is a little bit different, as you can see on the chart. They all offered some sort of either 2 or 3 minute voice message to where if the member got the phone call and it would dial from a local LPSS number, we could put one in. If they received a phone call and they weren't able to pick it up, it would leave a voicemail. So they offer something very similar. There's a couple where the characters are slightly off from the other, but your Blackboard, your Dial My Calls, and your Remind messages all offered those 3 opportunities for retiree communications.
Is sending a letter, is that out of the question?
No, letters are not.
Okay.
I mean,
I'm asking that because I'm gonna reference my mom, 94. You call her right now, she'll have a good conversation with you. I'll come back 5 minutes later and say, who called you? What was it about? She doesn't know. So that's why I'm asking, are you gonna eliminate it altogether? Because in some instances, if it's something important, I would mail it rather than call an older person. You know, I'm just saying.
I would say that we would use it in those important instances. Let's
Yeah.
use your example of your VCC wellness that you all do typically in the summertime period. Stuff like that that's super important where you want that retiree to have that physical through Ochsner's, yes. If I had a simple communication, likely not, because it's going to be labor intensive, plus it's going to be cost, and it's going to take time. By the time it hits their doorstep, you're talking a good 2 weeks later if you do snail mail. So if it's something super important, then we'd have to back it up and make sure that it hits the doorstep in enough time to where the member can act on it. But no, I don't believe it's completely out the picture, but we would utilize it a lot more with those 3 different features. I'm even asking to see if we can also offer, we post it to the website. That way they've got a resource on the website as well. And oftentimes I would direct them through a Google link to where they could click on it and it would have more details. Like if I send out
I'm listening to you.
If I send out a
I can say some
communication.
80-year-olds right now, they don't use the internet. I mean, you know, it's good for younger people, but an older person who's not tech savvy, everything you're saying right now will not relate to.
And that's our challenge.
Yeah.
In
That's a
all
big
honesty, that's our
challenge.
challenge with
That's a big
retirees.
challenge.
To
As a
include,
message we need to send out, I don't know, maybe they're not old enough, but on telephone with all these calls that you get, there's one of them that gets calls pretty regularly that says that your Medicare is expired and you'll have to renew it, or you're getting another kind of card and so on, and they go on and on and on and on. And if I've never gone through the full thing, I'll hang up on them, I'll tell them something. And but that's dangerous because I bet a lot of people have bit into that, you know. So something like this would be very helpful because that's got to be a scam because I Googled the Medicare, they said they would never, it would always be any type of information like that you would receive from Medicare in a letter.
But Trish, you have a phone component, is that correct?
yes,
Where they can call, and it can be from an LPSS number.
yes, exactly.
So they can recognize that it's
Right.
not spam and that it, okay.
Exactly.
That would
most
help.
most retirees know we've got a 521, and
Right.
if they see it and
Yeah,
it can populate with Lafayette Parish School
Right.
System on it, those entities that I mentioned can all do that.
So the other nice thing about it is, like, remember the Blue Cross, Trish can send a quick message saying, please be on the lookout, your Blue Cross Blue Shield cards are coming in the mail.
Right.
It doesn't have to be that it's a dramatic change, but just informational. Hey, your Aflac dental cards have been mailed out, please be on the lookout. It's just the little simple things too, as a reminder, or when something was printed wrong and we had to redo the Blue Cross Blue Shield, you could have sent a notice, both those away, the new ones are coming in instead of a postcard.
I think the phone component will be much more effective than email or whatever. But I know there are times you're going to use that, but at least you have the option.
Yes.
Trish, do you think this will help be a time saver for your office staff at all?
It definitely would. I mean, it's costly. I mean, we're mailing stuff. We're putting a stamp on it, essentially. It's the printing materials. All that costs on the administrative budget, too, when you're looking at it. Plus, it takes a ton of time. I mean, we have a folding machine, but then you got to stuff them and, yeah, I mean, we try and make it as efficient as possible, just like when we try and do the postcards, which I know sometimes are too small and you don't particularly like them. But it makes it easier for efficiency because all we got to do is stick the label that we've already printed. But yes, I believe it would be efficient for the office too. It would cut down on time and you would get the information quicker too if we could provide a resource.
Are all of those within the budget?
Yes, ma'am. I actually, at the time when we first started it, I did it at the 9,900 because Remind was one of them. Then I had 2 or 3 other options. But when you came back at the last committee meeting and you asked that you wanted the email, the text, and the phone call, then that narrowed it down. So all of these that are listed on your sheet are within budget based on the line item for next fiscal year.
So is there a motion from anyone for any particular one? Do you have a specific one that you would prefer dealing with, Trish?
No, ma'am, because like I said, each one of the ones that offers all 3 of those options pretty much provides the exact same features. With a give or take of a character here or there, we can all pull reporting, we can all still do it simultaneously. It really just depends on your preference.
Which is the one that LCG, Consolidated Government, used?
Blackboard
Blackboard.
Connect. Yes, ma'am. I reached out to them and that's where I got the quote from.
So you have no preference, Trish?
Not in particularly.
What's the cheapest one?
The cheapest, so Dial My Calls is offering a $4,992 annual contract. They are giving LPSS a 10% discount based on if we provide them additional documentation that we are a school board. It's like a $1,248 discount on an annual basis. Otherwise, it would have run $62.40 per year. That one does have 30 broadcasts per month, whereas your Blackboard Connect, if we were trying to compare those two, Blackboard Connect is unlimited. I personally don't see you guys getting 30 messages. I don't want to send 30 messages.
I don't wanna get that many.
I'm gonna limit my communications based on the importance of them. I won't bombard you.
Matt, do you have a motion?
Question, Trish.
Yes,
Will
ma'am.
you get a report on hangups?
Yes, a majority of these can all pull data within.
And you'll be able to
Who's
identify the phone
receiving
number?
them?
Okay.
Yep, who's receiving them, who's answering them.
Well, Trish doesn't have a preference on it, and she's comfortable with the 30 limitation. I think we're all comfortable with 30 limitation. That's one a day. I mean, my God.
Yeah.
Not counting weekends. So, counting
And
weekends,
Trish,
so
it's
I
a
would
one-year
suggest.
contract, right? If we're not happy, we can switch to someone else after a year.
Each one of them are annual contracts, so keep that in consideration.
And they don't have an automatic renewal.
No, ma'am, no.
Good.
So question if the one that is the 30 limit in a month.
And how much is that?
That one's $4,992, not quite
If we
$5.
don't get the discounted rate next time, how does that price compare to Blackboard Connect and the others?
Then it would be more expensive than Blackboard.
So like
In
if
that
this is a
instance.
one-time deal for the discount and then next year we go to renew, it's higher, we can bail and
It's a good
get
point.
something else, or we would be paying more than we would pay. from the
Exactly.
get-go.
Yes, yes.
I think we ought to go with it.
With Blackboard Connect?
No, with the
What's the name
30,
of that?
Dial My Calls. Dial My Calls is a little limit.
What's that name?
30 call it.
What was that? I'm sorry. Dial My Calls is the one that offered text, call, and email for $4,992 on an annual cost for 30 broadcasts per month. A broadcast is each one of those features. So if you're sending out one message, you essentially
So then
take
it's really
3.
10, you really
Yes.
get 10
Yeah, that's
Yes,
10.
exactly. Yeah,
instead of 30,
Yeah,
because
it's 10.
if you do 3.
exactly. Yes,
three,
it's,
then you-
And
And
so
let me ask you
Blackboard
this,
is
if they don't
unlimited.
answer the phone, does then that go again, do they call, and then is that number 4?
no, if they don't answer the phone, then they would leave a message. They'd leave a message on the phone.
And if they're not, if they don't have an answering machine or they don't have that capability, do you know if it then counts as another?
To my understanding, it does not dial back. A majority of us do have a voicemail, but you're correct. I mean,
And
it
then I wonder if
could
it would
be,
count as another one of the 30, which is actually 10 tries if you do 3
Mhm.
methods.
I'm not
I'm not trying to
100%.
confuse
No,
anybody.
I don't think it counts as 30 like per member, like 10 per member. So
Yeah.
like, if it doesn't go
Right.
through for you, you don't have 9 left.
So it
and
doesn't
you
scrutinize
don't
that,
have
it's
10.
not that detailed.
It's how many get pushed
I
out
see what
as
you're
a
asking.
whole. It's
Yeah.
not per member.
Yeah.
No. Total per month based on the amount of membership. Does that make
Okay.
better sense? So if you're utilizing essentially 3 per call, yes.
Right, so
Then
it's
you're
10.
looking at 10,
Right.
yes.
Trish, which one is giving us a discount but will cost more the following year?
That
The
one.
dial my
That
calls,
one.
yes.
So we would get a good deal for year one, but
Right.
then
But
the
not year
following
two.
year we'd be paying more than we would pay for Blackboard.
It would depend if they
If
extend
they
that
didn't honor
same
the
discount.
Didn't make it to that.
And what is the Blackboard cost?
Blackboard is $5,740 annually.
And what was budgeted, was it 10,000?
It was 9,000, I went with the highest, at the time we were
Right.
looking at Remind, so
Okay.
it's the 9,900 that's on the
I do
budget.
remember that.
So in any way, you're having a cost savings with either of those
Yeah.
2 items. And just keep in mind, if you do make a recommendation or a decision this evening, it is going out to the public. Am I saying this correct? It has to be posted if I need to make any changes to budget by tomorrow, Matt. Tell me that or
budget
not.
for the first year.
You have enough budget,
Unlimited,
you're good.
simply 'cause you
Okay,
don't
just
know-
leave it at the 9,900
Yeah,
without
then-
making
then
the
you-
change?
Yeah,
Okay.
simply because you don't know how many you're gonna send or what you're gonna send. You know, with the other way, you limit, you're like, oh, we can't send anymore, we finished, you know?
Well, we would be limited to the 30 broadcasts per month if you pick the Dial My Calls for the annual contract.
Correct.
So just keep that in mind. The other one, Blackboard has an unlimited broadcast per month based on an annual contract there too.
But that's what I'm saying though, because you don't know for right now
Right.
what exactly, maybe just try the unlimited one for that purpose. Because you don't know, I mean, it doesn't make any difference, but it, you know.
It
you'll
makes
get-
no difference to me. They're very similar in nature. It really just depends on what you believe that would better serve the retirees for communication purposes.
What's the difference in cost between
Yeah,
the
that's what I was
Blackboard and the
What
one-year
about
discount?
$748? Am I thinking that through correctly?
Oh, if it's just that, just go it down, huh?
Yeah,
I mean, that's a drop in the
4992.
bucket.
exactly.
748 is the difference between the two.
Go unlimited.
Yeah.
Yeah.
Okay, is there a
And then you
motion?
want to, next year, you won't have to start.
I
over, we're gonna
move
have
that
to
we
change it
recommend
and all.
Blackboard Connect.
I'll second.
And we have,
I will,
the system has
unanimous
used
second.
Blackboard Connect in the past, so it's not.
All those in
unfamiliar.
favor?
Aye.
Opposed?
Good.
Mr. Fontaine, you're up.
All right, folks. I'm happy to report the figures today because they're good numbers. We've got some savings.
Save a little bit of money.
Everybody have a handout?
Got a handout.
All right, let's go to page 1, and obviously this is going to be the first quarter of 2022. From a participation standpoint, there's not much change at all, less than 1% on the enrollment, membership-wise, even less. So we don't have any significant changes as far as participation goes. You can see your medical claims at a little under 7 million, prescription claims at 5,436,000, our total claims 12,395,000. Plan reimbursements 2,468,695. This is one quarter. You can look at the entire 2021 year and see that it's 7,000,006, and we don't have to be serious mathematicians to see how much that went up. Your reimbursements are up in a large percentage. Retiree drug subsidies, the same thing. Big increases, and Brooke covered some of that with you, and we'll go into more detail. Leaving us with a net claims figure of 9,337,530. Our total fixed cost at 986, adding the retiree Humana premium of 156,174, gives us a total plan cost for the quarter of 10,479,000. Obviously, when we're looking at a $51 million year in 2021, you can see that this is a significant decrease in cost. When we measure it on a per employee per month basis, which is the accurate measurement to compare an apple to apple here, we're talking about $607 on a per employee per month basis versus $749. Folks, that is a 19% decrease in cost, and this is the lowest cost you've had since 2011. Okay? Going to our next, and let me complete that with the funding here. At the same time, our funding is total $12,629,32, leaving a net employer cost of $6,841,736, and developing an 83% budget loss ratio. You can see that we were over 100% for the last 3 years. We're at 83%. We're in deficit mode for the last 3 years. We are in surplus mode to the tune of $2,141,063 on a plan year basis. Looking at our same report here on a per employee per month basis here. Our participation, once again, participation remains stable, up 1.1%. The Blue Cross participation only changed less than 1%, 0.96. Membership-wise, and remember, I always talk about enrollment versus membership, especially you being a school system and change of employment, industry-wise, all field, things like that, you could be in a situation where you're taking on a much larger percentage of people versus a larger percentage of employees and retirees. Folks, that's not happening, and demographics look very good right now. Medical claims paid down some 17.3%. I'm going to bring you to the second, third, and fourth bullets here. Category of claims from 5 to 10,000, 103 members this quarter, and this is measuring the same Q1 period of 2021. So we had 103 members with claims in that range this year, totaling 719,676. Last year, 143 totaling 980,159. That's a savings of 260,000. When we talk about members between 10 and 20,000, we actually had an increase, 84 versus 65, and an increase of 116,192. Between 20 and 100,000, 52 versus 82, and a savings of 1,080,306. In excess of 100,000, last year 6 members totaling 829,000. This year 1 member totaling 162. That's a savings of 666,397. The 3-month savings, when we incorporate the difference between that 607 and 749, equate to $2,245,000. That's a savings for this first quarter here.
But that saving is as a result of someone dying?
Ma'am?
Is that why you're saving? The numbers are decreasing because of death?
No, ma'am. When we talked about this in previous meetings, obviously we knew that 2020 with a stay-at-home order was going to be a year where we had favorable cost figures. When we talk about 2021, we're talking about probably a year and a half or more of utilization crammed into 1 year, because when the stay-at-home order lifted, everybody was going back to the doctor to take care of their needs. And so we saw this, and we get claims on a weekly basis. And so we know when claims are high, when claims are low. Claims on a weekly basis have not been pretty for a long, long time. And we are just starting to see in the last couple of months some normalization of things going back and normalizing. So you had a high cost year with a bunch of utilization in it, not necessarily. When we've talked all in the past, what's been the difference between a good year and a bad year? High cost claimants. This year, and these reports now, it's the difference in utilization. The utilization is starting to normalize now, which in past meetings I had mentioned that it eventually would, and I'm glad to tell you that we're seeing it in the data now. So the medical down some 17.3%. Our prescription drugs on a gross basis down some 3.2%. Total claims down 11.7%. When we get into plan reimbursements, our plan reimbursements are up 36%. Our retiree drug subsidy up 80%. Net claims paid down 20.8%. Okay? And of course our fixed cost, and I'm proud to tell you that, because when we negotiate these fixed costs every year, okay, that means that Blue Cross's administration, that means that the cost of reinsurance and things like that, we've been able to hold flat. So fixed cost remains flat, and Blue Cross coverage down some 19.2. We got a rate reduction from Humana this past year. That's factored into it. All of that brings us to $607 on a per employee per month basis, and a 19% decrease. This is over a decade since we've seen that kind of per employee per month cost. So this quarter is reflective of costs that we have not seen in 10 years. At the same time, even though we had a 3% increase in 2021 on our funding, and you see that when we go from 2020 to 2021, we actually had a little bit of a decrease in funding. We know that we have a slight increase in the number of people, but basically this is all two things. Demographics, which means that we are hiring more singles and folks adding dependents, and then also you have people migrating to different plans, okay? And that affects the funding as well. So with that slightly less funding, our net employer cost, okay, is going from 526 to 396. Okay, budget loss ratio to 180 to 83%, and of course 124 as far as our surplus goes. When we look at this on a more detailed monthly basis, obviously we had a pretty high month reflective of some of the claims clearing out from 21, and we started to see some normalization of claims. Remember, January and February are predominantly 2021 claims because there is a lag there. Deductibles and things like that, new deductibles will start to come in and all, but most of this utilization in this first quarter is really incurred in the final months of 2021. So you can see that we've gone from a $3 million health month to 1.9, 1.9, and thus far with 4 weeks into April, we're at 20,080,000 on April. So things are continuing to look good there. Pharmacy claims, I can tell you pharmacy claims are going up a bit because of our high cost utilization. Not because of significant increases in the cost of the medication, but each time you get one more utilizer on a $25,000 a month drug, it's going to affect these figures. We have a couple of folks in the plan now that have been prescribed medication in excess of $45,000 a month. Okay. There are not many medications in those categories. They're rare diseases, but when you do have those types of claimants, you're going to have those types of claims. That is all in this data, and we still have the decreases that I'm talking about. So it's these numbers in red that keep growing that are coming back to us in the form of rebates, subsidies, and we've had some minor specific reimbursement that was from the prior year because we don't have anybody over our specific reinsurance right now. So once again, good looking numbers here. When we go to page 4 and we're looking at things on a fiscal basis, I'm so pleased to report this because at the end of 21, on a fiscal year basis, we were sitting at about it was $1,561,000 deficit. We're at 47,000, folks. So that's about as close to breaking even. And then if we continue a few months here, we could have a situation where we're on a fiscal basis with a little bit of a surplus. And the next 2 pages are just prior years, which is just there for comparison's sake. We know we ended the year with an 834,000 deficit, and then of course 1,026,000 on a fiscal basis. I won't spend a lot of time on the enrollment data here on page 7 because there's not much of a change to it. We went up less than 1%, 0.96, membership only 0.3. But we did go up 2.3% on singles, and we actually went down almost 1% on those with dependent coverage. I'm on page 7.
Lynn, go back, so the money, the extra money for COVID money, that's included in the February number?
Let me ask this, because that's what he was just asking me. I know we get you get the report from the accountant. So it's included in your totals based on the account in the deposit, and it was deposited mid-February-ish. So I'm thinking it's gotta be.
Was it on her report after the last one she gave me?
We received it towards the end of February. It's now in a specific account.
Is it a new code
It's a
populated on
new-
that report?
Account number is what it is.
That is not bad. If it's a new account number,
Okay.
That's a
Yep.
question.
okay.
So that amount is over $1 million, Trish? The COVID money, is it over $1 million?
Yes, ma'am, it was 1.2 and some change. If, I don't remember the exact total.
I'm gonna pull the accounting report, because it's probably not pulling in that Essex code if it's a brand new code.
It's a brand new account number is what it is, and it's dumped specifically there, and it's named for COVID,
It's
essentially.
outside of the reimbursement tab, right? You know how we
Yeah.
have all the reimbursement, okay.
So Brooke, it's not included?
No,
Okay, that's good.
Which would have,
it's gonna make it look better.
Right.
Yeah, it's good.
enrollment by plan. Okay, we're on page 8. Blue Saver went up 1.5, basic less than 1%, enhanced 1.5. Not much change at all. You know, the premiums really aren't forcing a whole lot of migrations of different plans. You can see 3 years running basically 62, 63% for basic, 21 to 22, 23 on the Blue Saver, and then of course enhanced at the 15% percentile there. Membership wise, once again, not outpacing our participation. Page 10 with the medical. Certainly like the way this graph looks. You can look towards the left from 420 and you're not going to see that number, which means that this is the lowest medical cost that we've had in quite some time. And once again, just on the medical side, about $1.8 million as far as the savings go. Prescription drug wise, down some 3.2%, while high cost medications increased 8.5%. Net cost after reimbursements and discounts decreased 26.7% as compared to 2021. So all of the increased negotiations that we did for discounts, rebates, all of that kind of stuff coming to fruition here. Net savings on Q1 for pharmacy is right over $1 million at $1,010,000. Total paid claims, lowest in 5 years here, decreased, this is page 12, some 11.7%. Paid claims net of reimbursements down 20.8%. And then once again, our reimbursements up some 36%. Page 13, performance of the 3 plans. Obviously on our enhanced plan, if you look at the bottom 3 bullets here, the enhanced plan has 15% of the participation and 22.5% of the claims. So it's not supporting itself. Basic plan, 62 of participation, 64 of claims, coming close to breaking even. And Blue Saver, obviously supporting the other 2 at 22.6% of the participation, but only 13% of the claims. Total plan cost on page 14. Once again, down that 19%. When you take the delta between the 749 and the 607, and you multiply that times 3 months times your participation of 5,757, we have saved in the first quarter $2,452,482. Almost the same savings when we compare Q1 of 21 to Q1 of 22. It's in that same $2,245,000 range. Claims by type of service on 15, and this is what we were talking about, and, you know, and why are we seeing this decrease in cost? We're talking about a lot of decrease in utilization. Look where we've gone here. If we look at 2020, we had $156 per employee per month number on inpatient. 2021, 128. We're at $78 right now on a per employee per month basis. That is a 39% decrease. Outpatient down 20%. The professional is staying steady, and it's still high. And at 198, only coming down from 199. And when you look back, it was in the 170, 169 range. I do think that that's going to normalize as well too. You got a lot of people going back to the doctor to get back to their normal things, diabetes checkups, circulatory checkups, blood pressure, things like that. From a top diagnosis standpoint, and if you look back, it was always musculoskeletal or circulatory. It's still circulatory, but look at the number. We went from $22 per employee per month. It was 21 in 2020. We're now at 14. Pregnancy and childbirth jumped up to number 2. Okay. Musculoskeletal down all the way to $9. Okay, from 15. These are all pretty significant decreases. The only one of all of these categories that actually went up, we have a new injury and poisoning because there was some injury claims in there. And then you have when a miscellaneous category like symptom, signs, and abnormal findings makes you top 10, that's a good thing, folks. Okay? So musculoskeletal down. I'll tell you this, just in 2021, $234,000 spent on Regenix. Okay? First quarter of 22, 93,000. Those procedures average about 7-10 grand a piece. Okay? On a musculoskeletal surgery, I can tell you it's not 7 to 10 grand. Maybe $50,000 to $70,000 would be a more range. So if we multiply those types of procedures, think how much money we've saved with that program. Okay? So that's working well for us, and kudos to the additional education and communication out there, because we're starting to see some results there.
And I'm not trying to burst the bubble, but does it stand to reason to think that as the year progresses and people's deductibles are met, like Carol was alluding to, that these numbers are gonna all inflate?
That's
And
correct.
become more
These
typical?
numbers are normally going to inflate as the year goes on, but at the same time, we're coming down off of all of that pent-up demand. So if it comes down to pre-pandemic type of levels, we're still going to be way into the savings. Okay, because as we all know that this case is seasonal.
Yes,
Okay.
exactly.
You're always going to have deductibles in the front of the year.
Yeah.
Okay? You're always going to have a little additional utilization in the summertime. Okay? All of that are givens, and we know that. But what we also see and know is that 2020 had a stay-at-home order. 2021, and I can look at your plan and all of your peers, and they all reflect the same data. You had a year and a half crammed into a year utilization-wise in 2021, and so as that normalizes, we would expect to see better figures. Okay, so that's why I'm just happy to finally see that weekly number coming down instead of a $700,000-800,000 week. You know, when you get a 500, 550, or something even under 500, your numbers start coming down. And, you know, I know 19% decrease sounds like a lot. And I know that 2 million plus of savings in the first quarter sounds like a lot. But remember how quickly it went up, folks? Okay? The law of gravity is going to work in our favor this year, hopefully, unless we start having rational claims. Now, I'm going to tell you on another side of it, when you got a stay-at-home order and nobody's getting screened for a long time, we're probably gonna pick up some things from screenings this year, okay? And have probably maybe a little larger share. We've got reinsurance, we're doing well. We've got a ton of additional cost-saving measures that we put into the plan, and they're working for us, okay? On outpatient, on page 17, factors influencing health is a category that includes chemo, okay? It's still number one, but look how much it's gone down, from 33 to 23. Every single item on here, when you look at the PEPM cost, is going down. From musculoskeletal, neoplasm, which is cancer, circulatory, digestive, every single one of them down. Top facilities, first time we've had a little change here. It has to do with some of the larger claims and things like that, and so this will be something I'll be watching. Lafayette General's had the majority of the market share for all of the years running here, and Lord's is ahead of them in this quarter here. And we'll be watching that. We're constantly looking for ways to get additional discounts from these folks, and we'll continue with that. Nice to report on page 19 that we're back up to 87% on our generic utilization. Who wants to tell me why? If you remember from the last meeting, we were down at 85%, and the only reason really was is because we had the brand name vaccines mixed into the data. Obviously, that's not taking place anymore. We're right back to 87%. Good news there. Next page, what I like even more about that is we went from 15% to 13% on that generic there. Prescription drug utilization, actually down on a per employee per month basis or per member per month basis. Used to be good. Some of that has to do with more mail order utilization, but on the whole, I've seen this on all of our cases. Utilization pent up and normalizing there. Top 10 drugs by number of prescriptions. No vaccine, okay? The only thing I'll mention to you on here, none of these are high-cost medications, but we do have a little more psychotherapeutic. That's just a sign of a pandemic and all, and when we talk about pushing EAP and communicating EAP, we're seeing some more traction there. This next page is always such an important page to me. I mean, when we first started doing this, I don't think our prescription drugs were 20% of the total claims. Prescription drugs are 40% of the total claims now, okay? So this page becomes more and more important every time we meet. And when we talk about all of these, they're a category of anti-inflammatories, Humira, Stelara, all of these type of medications, what you see advertised on TV. I mean, the cost range starts at about $5,000 and goes up to about $25,000, and they all treat the categories of rheumatoid arthritis, Crohn's disease, severe to moderate plaque psoriasis, all debilitating diseases. And they're effective, but they also keep you out the hospital. So prescription drug numbers are going to go up, but a Crohn's disease patient in the hospital is not cheap. Okay? So we might see higher numbers on our prescription drug side, but we're seeing lower numbers on the medical side, which is more expensive. Keep in mind though, this is only 2% of the prescriptions, and it's 31% of the money. That don't make you say wow. Okay, you've got two medications down here that the inhibitor and the one right below it, the polyneuropathy. That's just those medications are in the range of $35,000 to $40,000 a month. Whoa, has a disease called Angiodema, and it is very, very serious if not treated. And individuals with this medication can live a normal, healthy life, but it is quite costly. Same thing with hemophilia. Treatment for a hemophiliac is 7 figures a year, but it works.
A lot of those are the
Constantly,
people
we'll
who
be
get that
looking for
coverage.
solutions.
Yeah,
We've got a
Yeah,
solution.
really, yeah.
We've got a few things that we're looking at with some of these high-cost drugs that could well bring some costs down, and we'll be presenting to you in short order. PPO savings at 70.6. Growing, that's why we remain with the network we have. Through Blue Cross, we've talked about this in the past. Other carrier networks, probably within the range of 5 to 10%. 5 to 10% of your medical is a huge amount of money. So that makes a difference. Network utilization dropped, even though our percentage went up. Network utilization dropped from 98.3, 97.3, 96.7.
But we're only looking at 3 months. You're not looking at a full year. So when you say it's a drop for 3 months, not for the whole year. Because you're only looking at January, February, and March.
Right.
Am I correct?
Right.
So it might
That's why
not
we
be-
measure things on a per employee per
Yeah,
month.
it might
year.
not be as significant when you get to the end of the year.
Well, I thought it was, so anytime I see a change in these numbers, I start looking, okay? Because I want to be able to tell you why, okay? The reason why we're going from 97.3 to 96.7, and some of you at the table might be able to guess.
I think I
Genetics is
know.
not in your network.
I just found out, yeah, county network. But Glenn, I have a question about that, because I was a little surprised this week. Had a simple procedure, needed an anesthesiologist. Got the bill, had to pay 40%. They were out of network. When I called Blue Cross, the lady in Baton Rouge told me that our plan had no anesthesiologist covered in Lafayette. Is that true? I mean, this was a simple procedure. I have a major procedure coming up in the fall. I mean, anesthesiology, I'm gonna take out a loan.
Anesthesists don't like to join a network, obviously, because they've kind of got a monopoly, but they have, you can't, because of the PPO laws, you can't charge an out-of-network or anything like that.
Well, no, I mean, I paid 40%, which I've met my deductible, so ordinarily I would pay 20. It doesn't affect people on Medicare, because Medicare covers anesthesiology. But active people and those of us that are not on Medicare are having to pay 40%. Is there any way we can kind of like put some in the network so that our doctors can utilize that, and that would be a cost savings?
We'll do network lookup to see who is.
Would you do that,
who isn't.
please?
Absolutely.
You know, and I know I have to pay it because it was out of network, but I was a little surprised when she said, let me check your plan. She said, your plan covers no anesthesiologist in Lafayette, which was, you know, we're a pretty big city.
Did they balance bill you? Did you get a bill in the mail from the anesthesia
Oh, yeah, I did.
provider? Okay.
And I'm paying 40%.
Yeah, because sometimes the provider, knowing that you use the network provider, will write off the difference if you call them and say, hey, you know, I didn't have any choice, I had to use you, I went to a network provider, and they'll
No,
write
they
it
didn't,
off.
they got the bill.
They did, okay.
So-
I'll definitely research
So
it.
Okay,
do we
thanks.
have an anesthesiologist in our network?
What's that, I'm sorry?
Do we have an
I'm gonna
anesthesiologist?
have to research, I'm gonna
Okay.
do a provider lookup and check
Yes.
on
And
that.
if not, for the
That's
next
the Blue Cross
negotiation,
network?
if we can kind of
You
put
talking
something.
Blue Cross network?
Yeah, like certain,
Shit.
Yeah,
That's
man.
a lot.
thinking
Think about
yes.
it, folks, you would,
Yeah.
with all of the
Yeah.
anesthesia that's given in your plan on an annual basis, you would know it if they were all not network.
Yeah, we would have gotten, I'm sure, some noise around with all the surgeries in outpatient. People would have been complaining that the anesthesiologist was out of network. So I'm gonna definitely
Will you
research
check
They
that?
didn't
that
tell you that?
absence.
They didn't tell you that before you?
No.
before you actually-
No.
I would call and I would appeal.
I'll go with Will.
Okay,
Because
I
they
mean,
didn't
I was
tell you
shocked when I
that.
got the bill, it's like, wait, I've
No,
got my
no, no,
deductible.
I would call.
Okay.
That's
Just like I said, there's a major surgery in the fall, and it's like, that one's gonna be
make
major.
sure that, I mean, make them
It's
approve.
clear.
They're supposed to, you know, when you give you the Blue Cross card, they
Yeah.
should be looking, because they know you're.
You should know,
Well, yeah, I mean, the
yeah.
doctor was in that work, but the anesthesiologist.
The same thing
was
could
not.
happen if you have a surgery, let's say you have an emergency surgery and that emergency physician's not credentialed. So that happens as well, but,
Okay. The name of the group was Precision out of Lafayette.
One more time?
precision.
Precision. Huh?
Precision billing.
Yeah.
Well, we had a situation where the emergency room doctors were just contracted, and we were getting a bill from them until we resolved that problem. That was a couple of years ago. And, you know, they worked it out.
Yeah,
But we were getting, in other words, if you went to the emergency room, man, they slapped you with the bill from the contract doctors in the emergency room, not the hospital. It was weird, but we got it resolved, so that was pretty cool. So maybe we can do this.
Hospitals used to do that with anesthesia, radiology,
Really?
and emergency room. So the emergency room docs, you would assume work for that
Well, yeah,
particular
exactly.
facility, and they don't.
And they don't.
No, they're
Okay.
contracted out.
Anesthesias, or anesthesia, sometimes you would assume that they work for that particular hospital. Most cases they do, sometimes they don't. Okay. And same thing with the radiologists.
The
So
same
where can
thing
I-
is happening with the walk-in clinic, because by our school, we have a Lafayette General, might be Oshner's walk-in
Blitz
clinic.
Oshner, Lafayette General, Blitz
And
Oshner.
I went over there, and it's always been part of our insurance. But the doctor I saw at that time was not part of it, so I had to pay her. And I didn't ask when I go in, I thought that every doctor, I've never had that problem. I thought every doctor that was there.
And that one doesn't sound common. That might be that doctor was new and not just credentialed yet.
It's true.
So Brooke, can I call you in a couple of weeks about
yeah,
anesthesiology? I'd like to know
I'm
if
gonna
any of them are
check,
covered.
I'm
I mean,
gonna
in that
check
work.
this out for you
I appreciate it,
tomorrow.
thanks.
I'll tell you this, the one thing that we're seeing across our book is, especially with hospitals, we're seeing they're having staffing issues,
Yeah.
since COVID. So it doesn't really surprise me that they're losing some of their tenured employees who
Right.
were contracted and fell under the facility, just to
Yeah.
keep their doors open, they're having to contract these providers, so.
And that
You
could
might
be what
see some
happened,
of
I don't
that.
know. Okay, thanks.
The thing they should let you know when you're checking in, they should.
Some like traveling nurses, you know, they belong to a different company, and they send them to wherever. But they're contracting on the different company, not the hospital. Weird.
I was just surprised.
Yeah.
We're on 26.
On to page 27, contribution analysis. And obviously, plan cost is coming down, and plan cost net of employee contributions is down almost 25%. Even while funding was down slightly. Page 28, we really covered this, but this gives us a breakdown by, and these are the same bullets that were on the first couple of pages. Those ranges of $5,000 to $10,000 claims, that came down about 260. A little increase between 10 and 20. Huge decrease between 20 and 100,000 to the tune of $1,080,000. And then, of course, our large claims over 100, we've only had one this year versus 6 last year. So when we talk about why did claims come down, we know we talked about the utilization, but obviously we're having less large claims members, and you combine those both and you're gonna have a pretty report. Hopefully we continue to have this normalization of claims. We'll continue to work on saving strategies and hope to build a surplus.
It's the best report you've brought to us in a number of years. Yeah. So thank you very much.
Yep, it all sounds like
Thank you,
we're in
people, for
good
the
shape
loyalty.
financially with a lot of this.
Yeah, but you have to remember, we're only 1 month away from.
Correct, but this answers,
Yes.
Yeah.
the, with the raises that were given, was Was the insurance impacted, insurance funding or any kind impacted by any of those raises?
No,
No,
He's
the
asking
raises,
you.
so we're giving a 2% inflation adjustment.
Matt, can I stop
I'm
you?
sorry, okay.
I don't believe that that should be a discussion, am I thinking that through correctly?
I would agree, I'm just trying to figure out what the question is.
Like the step increase.
Yes,
Oh, no,
ma'am.
that's automatic.
That's automatic,
But
and
we're
that
talking
comes out
about,
of
because there
insurance.
was substantial raises that were given.
It was reclassification.
That's not an
Yeah,
agenda
yeah,
item.
yeah.
It's, yeah,
Yeah, if there were any reclassifications,
That's
That-
substantial, but the other is a 2%.
Okay.
Right.
and I think the state just passed a $1,500 raise for the teachers and then $750 for support. So that's coming down the pipe for teachers too, so that's good. But we're still not at the Southern average,
That's
which one of those crazy things, yeah?
Any questions for Lynn before we go on to the next item? Thank you very much, Lynn. It's nice to have a good report. For change. A couple of announcements. Last night, the board did, except if you remember at our last meeting, the decision was that that half position, that the committee did not think it should be filled, but if the board did think it should be filled, it should be paid for out of general fund. And Matt, correct me if I'm wrong, it was paid for out of general fund.
Yes, it's,
Correct.
it got moved into the general fund.
Cool.
Excellent.
And it will be
That's
coming
good
back to
news.
insurance.
Good news.
Nah,
Matt, will it come back? It's not coming back to
I can't
insurance.
predict the future.
I think.
We'll be
We have
looking
9
next year. The other, two other things I think you should be aware of, and I can't be specific because I'm not allowed to be specific, but I think it's important that you know that there were 2 items on the agenda, one requested by a member of the committee, and one that came from a committee member dealing with information that I think the committee should have been aware of, and we weren't made aware of it. Both those agenda items, I was directed that we could not discuss. That's never happened. I talked to Butch, he's probably he and Carol have the longest history. That's never happened before.
So
But
say that one more time, maybe I didn't
there were
understand.
2 items on the agenda that our committee members asked to have on the agenda. And I submit the agenda. I had to be early this time because of the Easter break, and I received an email back that that these 2 items had to be deleted from the agenda.
That's why.
Don't ask me, I have no idea.
What would that be?
Miss Nancy, it can't be a discussion. It can be your chair report, but we can't have a discussion. Yes, ma'am.
I'm just telling you. Okay.
Under what policy?
Yeah, I'm not understanding that.
A chair report is a report, but what we're migrating to is a discussion right here.
Could you put it on
So
the
it's gonna be on
agenda?
the
So
next
if
agenda?
that's the case, then it would have to be an agenda item
Yeah,
for
the next
discussion.
agenda,
So we'll
next
be-
agenda though?
I will put them back on the next agenda, but I'm telling you, we'll probably end up,
Well, as an advisory committee, we're supposed to advise the board, and they can either take or reject
Right.
our recommendations, but
But if
we
can't
should
discuss
control
it,
our agenda.
yes.
I mean, why are we
Why are we
prohibited?
saying
Actually,
from
I'll go ahead and answer that. The items were reviewed by the superintendent, and the superintendent removed them from the agenda because it didn't fit the criteria of she felt that it didn't fit the criteria. Mr. Mouton, do you want to help me with that one?
Yes, ma'am. I think some of what we're experiencing right now is, this is the chairlady's report, but it's turning into a form, which is what Ms. Trish was alluding to, and we've been advised that it should not be. It should be, this is the report.
I'm just reporting
Yes,
that there were 2 items I put on the agenda, and they were removed, but not by me. And I think I have an obligation to the committee to let them know that.
But then it's turning into a discussion,
Right.
just like
I'm not
we're a couple
discussing
minutes in
anything.
it.
I don't even know what she's
But the
talking about.
members are. Yes,
I don't
ma'am.
know what she's talking
It would
about.
have to be an agenda item, just based on
Yes,
if the
well,
meeting's
well,
long.
yeah.
Like, young couple, why would you not discuss anything? I mean, just,
You are governed by
because-
open meetings
with
law, so
open
keep
meetings-
that into consideration.
Yes, ma'am.
Can we just add it to the next agenda and not make it
I
an
did
issue?
already, I did.
Yeah, let's not make it an
I
issue.
will,
Open meetings law, though, but wait, Church, open
Yeah.
meetings law, though, if she asked you this, how far in advance? I mean, I can understand the day of the meeting, she puts it on the agenda, then
Yeah,
that,
like today, and there was an objection.
I'm referring to open meetings law with the fact that you can only discuss the items that are listed on your agenda.
And we
So
were
now we're
trying to
working
do
towards
that.
a
we're trying to
discussion.
do that, but obviously there's a problem there.
Right. Just based on, as Ms. Gardner mentioned, it was superintendent removed. So
And
keep that in
It
mind.
is
the
this.
decision was,
Can
as
we
I
not discuss?
recall, that they were not, Jennifer can correct me if I'm wrong, they were not pertinent to what the bylaws or what the committee responsibilities
Is
were.
that a bylaw?
I have the bylaws. It specifically
That too.
states, it states transparency on all matters concerning insurance. I can read it to you, okay? And I didn't want to get into this because you're right, you
Well,
know.
I think this is some of the issue that nobody is questioning Ms. Mountain's report. But again, it has turned into an open forum, which is what we were advised that it was not supposed to turn into.
But John, this is an advisory committee, and it says the insurance provided to the Lafayette Parish School Board, active and retiring employees, is self-funded. Therefore, recipients shall have input into the benefits as stated in Lafayette Parish School Board Policy, BBC. The Employee Retiree Insurance Advisory Committee is an advisory committee to the Lafayette Parish School Board under file BBC. The committee is intended to assist the school board in effective and transparent programs provided by the school board on all proposed budgets, budget revisions prior to the school board's consideration. So I don't know why that should be in question.
And
But it's
I
policy.
understand that, but with all due respect, that was what we tried to put on the agenda. It was voted no. And
Oh,
now
tonight,
it
yes,
is.
but I want it on the next agenda.
But still,
Because I'm
it
following
still
policy
came
and
back
I'm not
on
sure
the
everybody
agenda
is.
tonight, and it was still discussed openly tonight,
But I
even
don't
though
know
it
what-
was.
No, it's not,
What are we
because
discussing,
half the
y'all?
people don't know what we're
I
talking
don't know
about.
what you're talking about.
I'm gonna close the meeting. The items that were removed from the agenda did not fall under the BBC as far as
Yes,
health
it did.
programs.
That's a matter
One
of
them-
opinion.
One of them, Miss Landry, one of them was a reclassification in the department, which came
Now
from
you're discussing it,
well, it came from general fund, so that's why it does not fit
but
the
it said
criteria.
all budgets. And you can't tell me that that does not affect insurance. It affects the workings in insurance.
And then the
So it's
other,
related. I don't know how you can say it's not related. And I know I'm not gonna win this debate tonight, but I think as a committee, we have a right to discuss it. It's in policy, and I'm not trying to be ugly, and it's nothing personal. And I don't wanna get into it because I'm gonna get accused of discussing stuff that's not on the agenda. But I do want it on the agenda for the next time, okay?
I will do
And
it.
it addresses transparency, which is a general term. It's in policy, it's in the bylaws, and actually our bylaws are part of the Lafayette Parish School Board policy, and it is up to administration to enforce policy.
Next meeting will be in, Trish, is it in July?
July
Is it
26th, if I'm saying that
Or is that
correct.
today's date?
I'm triple checking. July 26th, if I've
Next
heard
meeting
it.
is July 26th, if not before. Is there a motion to adjourn?
I so moved.
Butch, is there a second?
Second.
Carol? All those in favor?
Aye.
Thank you.
Turn the hearing aids off.
Let's go home. And superintendent's not doing it.